passionate advocate, and that's Lenny Preston. She is the chair of the coalition and has worked mightily since the passage of the Affordable Care Act to make sure and to ensure that the consumer's voice and the consumer's perspective stays present in the rollout of the bill and the continuation of the law as it's administered in the state of Maryland. The coalition is a grassroots organization, alliance of thousands of individuals and over 100 statewide organizations, and we're working literally to ensure that all Marylanders have access to affordable quality care, health care. So the coalition has been behind a lot of the reform work that's rolled out in the state with regard to the exchange and how enrollment in the Affordable Care Act has occurred with regard to the consumer perspective. So our legislative focus this year will be on assuring that there is no rollback on the gains that Maryland has made across in terms of the rollout of this law in the state. We will also be working very diligently to continue to ensure that consumers understand the various perspectives, the various changes that are occurring, and the very basis of the law, and how to access care. So the coalition has a campaign, Got Card, Get Care, because insuring an individual is just part of the issue. Making sure that individuals are accessing care, understand their benefits, have the health literacy to understand the instructions that they're receiving from providers, assuring that there is adequate provider networks and relevant provider networks. And so that's the type of work we will be doing. We will be building a new relationship with our new administration to ensure that there is no rollback on any of the gains we've made, and that access is in the forefront of the work that's accomplished. Thank you very much.
Next, we have the No Boundaries Coalition.
Good evening, everyone. My name is Ray Kelly. I'm the president and I'm the safety committee chair of the No Boundaries Coalition. And the No Boundaries Coalition is a resident-led initiative that breaks down the boundaries of race, class, religion, and neighborhood in the 7 neighborhoods that surrounds Pennsylvania Avenue in Baltimore City. So for the past year, we've been advocating for police-resident relationships to actually become initiated, because there are seemingly now 350 people that we've had a listening campaign with this year. There are no relations. So that's what we're looking to create, a community policing model. We've actually been in talks all year with Western and Central District on actually forming foot patrols again on Pennsylvania Avenue, which is a battle that took a year, but we did win foot patrols finally this month. So we're advocating now for policy change as far as budgeting for sustained patrols. We also want to contribute. We're working with a couple coalitions right now to reform the civilian review board in Baltimore City, where we just want to try to change the language more so they could, I don't really want to say have teeth, because unless we actually have influence on how we get those people on that board, we don't want to give teeth to something that'll bite us back. But we definitely want to have the opportunity to start the change. So we're working with other organizations, and we're also working to find other organizations and coalitions to reform Maryland's law enforcement officers' Bill of Rights, which seemingly has caps on liability for the state. The officers get paid leave, investigated, and pretty much their Bill of Rights alleviates all our rights. We have nothing. If we go by what their policy is, we have no rights. We want to actually establish policy that's fair to everybody, but we want to make sure that the police officers have fear of consequence for what they do. When we have an interaction with the police department, instantly we fear all the consequences they run through our heads. When the police interact with us, they have no fear. They're going to be home paid for a couple of weeks, and we're looking to find the proper legislation to actually change the way they police our neighborhoods, and we're trying to build up a contingency to take to Annapolis to get this change. It may be small steps in wording, but in our communities where we're not really getting any interaction from the police unless it's a negative thing, this is a huge thing for us. So our table is also in the back, and all community organizations, neighborhood are welcome at No Boundaries. We have no boundaries. So if you come from Florida, come to No Boundaries, join the fight, and we'll fight with you. Thank you.
And last but not least, we have the Public Justice Center.
Say in Annapolis, they only give you 3 minutes to testify, so 5 seems excessive. I'm John Nethercutt. I'm the Executive Director of the Public Justice Center. We're pissed off lawyers for social change. We use a variety of strategies. We educate people about their rights. When their rights are violated, we represent them in court. But we often find that for our clients, the rights that they have are stacked against them. We can go to court, but the law is not on our favor, no matter how good the facts are. In that case, we have to go to Annapolis to change the law. So that's what we're going to talk about tonight. I'll run through quickly a number of the issues that we're involved in. I will say that almost everybody you heard earlier tonight, we're already working in coalition with them. So I'm not going to go over a lot of those bills because you already heard about them. Let me start by this. In Baltimore, half of the residents of Baltimore are tenants. But 77% of those tenants cannot afford market rent housing. As a result, there are over 150,000 eviction complaints filed in Baltimore City every year. 5,000 to 7,000 people are put on the street as a result of that. We have one of the highest eviction rates of any major city. Tenants are afraid to complain because they know that their landlords can retaliate against them and often get away with it. So the Public Justice Center is involved in 2 types of bills. One, housing affordability. We and the Homeless Persons Representation Project are leading an effort called the HOME Act, Housing Opportunities Made Equal, which would prohibit income discrimination. And by that, I mean people are being discriminated against if they have a Section 8 housing choice voucher, or disability income, or government assistance of some sort. Some landlords will deny them the right to rent or buy housing. We're trying to make that illegal, that kind of discrimination. It's been a multi-year fight. We could use your help on it. The second thing is landlord retaliation. Major issue. We've made some major changes, some major reforms. We've got a ways to go. Second subject, you've heard a lot about this, wage theft. 2/3 of people living in poverty are working. 2/3 of the working poor experience wage theft every year. They lose 15% of their income because their employers do not pay them the wages that they have earned. We've been on a multi-year campaign to stop wage theft in Maryland. We've passed some good laws, some more enforcement tools. There's a long way to go. There is a major industry that opposes it. Chamber of Commerce doesn't like our approach to this very much. And they have a lot of power and a lot of lobbyists. But we've been chipping away at the legal things that will prohibit wage theft. And we will continue to do so this year in Annapolis. Another issue, the paid sick days. We've been working with JLTF and the Working Matters Coalition for several years now, and we believe this is the year we will pass paid sick days in Maryland. We also are involved in a number of other issues, healthcare advocacy. The Medicaid program is the health insurance for poor people. That needs to be maintained and if anything, strengthened. And as the Affordable Care Act rolls out, we're very involved, particularly in budget issues. Not particularly fascinating budget issues, but you know what? Budgets are a moral document. It tells you where your society is putting their emphasis. We need to make sure that the Affordable Care Act preserves the Medicaid program for people who are living in poverty in Maryland. We work with a homeless representation project on homeless kids and the Women's Health Care Coalition. You guys are the leaders in it, we're just followers. And we also work on unaccompanied youth and homeless kids who have the right to be in school, but often are denied that right. And last but not least, we also are involved in a range of access to justice and civil liberties issues, including we will be supportive of the Police Officers' Bill of Rights reforms that I know will be coming this year, and a number of any other issues that basically keep people from getting the justice to which they're entitled. Thank you.
I'd like to take this opportunity to invite Adar Ira to come to the stage to talk, just give some closing remarks. Associated Black Charities works to help facilitate some of these policy changes, and has been a great partner for us in helping to work in that regard. So
it's going to take me a minute. Thank you. Okay, so what happened was I have a 3-year-old niece whose fall I was trying to break, and I did. Unfortunately, it was on my ankle. So I've got about another 4 to 6 weeks. But I want to thank you all so much for being here. And I am not closing out. I wanted to say a thank you to our partners, University of Baltimore Office of the Provost, and Leaders of the Beautiful Struggle. You both are great, great partners, but also to each of the groups who have presented, who we've worked in partnership with in some form or another, and also to you, all of you, because you are partners just waiting to be discovered. And we found you now. So John said that budgets are moral documents. I want to say to you that policy is moral, because policy tells us about whom we care in society and about whom we don't. And even though we have not explicitly said this evening, policy, the impact of the policies about which each group has been discussing is racialized. And if we do not acknowledge that and plan for that, if we do not walk into policy and each of us use the information that we have to help our policymakers expand their lens, then we will continue to get what we have always gotten. So the work of Associated Black Charities and Policy, we are not pushing any particular bill. What we are is a resource for that expansion of a lens. We look at proposed policy and existing policy, and we try to talk about with you, with our partners, with policymakers, what the racialized impact, potential impact will be on our communities. And this isn't about anybody saying, oh, we're definitely going to get those people. What it is that we all come from our own perspective. So if you are making policy about bus routes and you drive a car, how good is the policy going to be? Right. That's what the expanded lens is about, and that's why you are so important. And that's why it is important that we come together, because we use a racial equity lens. We are putting the final touches on a brochure that talks about using a policy application of a racial equity lens. We would love to share that document with each of you when it comes out. You will in the future be able to find it on the ABC website. But I would urge all of you, as you talk to our advocacy groups who've made these wonderful presentations, as you work with all of us, please, please expand your own lenses so that when you are doing advocacy work, you are doing it with a racial equity lens, and let us help you in doing that. Thank you so much for coming out on a Thursday. I want to introduce our COO, Valencia. Valencia, please come down. Do you want to close out? Okay. Like, no, I want to go home. So I will leave closing out to Davon Love.
Said, really can't be said any better. I hope everyone, after you leave here, check out the tables that are outside. Please get involved in many of the different efforts. I'm going to be checking out people's tables and collaborating, trying to connect with folks. So please take this opportunity.